Hello everyone, and welcome to our channel. Today, we're going to talk about something really important and often misunderstood: gender dysphoria. This is a safe space to learn and ask questions, so let's dive in. What exactly is gender dysphoria? Imagine feeling like there's a deep disconnect between who you know you are on the inside and what people see on the outside. That's the core of it. It's the significant distress a person feels because their gender identity, their internal sense of being male, female, a blend of both or neither, doesn't align with the sex they were assigned at birth. This isn't just a fleeting feeling. It's a persistent and profound sense of unease or discomfort. For many, this distress can be so intense that it affects their everyday life, leading to serious anxiety, depression, and a constant feeling of being out of place in your own body. It can make school, work, and social situations incredibly challenging. The feelings associated with gender dysphoria can manifest in various ways. Someone might have a strong and persistent desire to live as a different gender. This can include wanting to change their physical characteristics to better match their identity, like their voice, hair, or body shape. It also often includes a deep need to be seen and treated by others as the gender they identify with. Using the right name and pronouns is a huge part of this. It's about aligning the external world with their internal truth. It's crucial to understand that simply being transgender does not automatically mean a person has gender dysphoria. Many transgender and gender-diverse people are happy and comfortable with who they are, and don't experience this level of distress. Gender dysphoria specifically refers to the clinically significant distress that can arise from that incongruence. So, how can someone manage these intense feelings? The great news is there is a lot of support available, and the primary goal of any treatment is to help the person feel more comfortable, reduce their distress, and improve their overall quality of life. Let's talk about the different paths people can take. One of the most valuable first steps is psychosocial therapy and counseling. Talking to a therapist who is knowledgeable about gender issues can be incredibly affirming. Therapy provides a safe, supportive space to explore feelings, develop coping strategies for distress, and navigate social situations, like coming out to family and friends. It can help build resilience and improve overall well-being, whether or not someone decides to pursue medical options. For many, medical transition is a vital part of aligning their body with their identity. Hormone therapy is a common option. This involves taking hormones to induce physical changes that match a person's gender identity. For transmasculine individuals, this typically means taking testosterone, which can lead to a deeper voice, facial and body hair growth, and muscle redistribution. For transfeminine individuals, estrogen can lead to breast development, softer skin, and a redistribution of body fat. These changes can be life-affirming and significantly reduce dysphoria. Gender-affirming surgery is another option for some individuals. These are surgical procedures that alter a person's physical appearance to be more congruent with their gender identity. This can include top surgery to create a more masculine or feminine chest, or bottom surgery to reconstruct genitalia. These decisions are deeply personal and are usually made after careful consideration with healthcare providers. It's often part of a broader treatment plan that might also include hormone therapy. Beyond professional medical care, the power of community cannot be overstated. Finding a support group, either in person or online, can be a game changer. Connecting with peers who have similar experiences provides a sense of belonging and validation. It's a space where people can share their stories, ask for advice, and simply be themselves without fear of judgment. This is especially valuable for those who might not have access to professional help or a supportive family environment. Now let's clear up a few important points. First, gender dysphoria is not a mental illness. This is a critical distinction. The distress it causes can lead to mental health challenges like anxiety and depression, but the identity itself is not a disorder. The medical community recognizes this, and the focus is on providing affirming care, not curing someone's identity. Second, the goal of treatment is always centered on the individual's well-being. It's about reducing distress and helping them live an authentic, happy life. There's no one-size-fits-all approach. Every person's journey is unique. That leads to our third point. Treatment is highly individualized. What works for one person might not be right for another. The process is a collaborative one, involving discussions with doctors, therapists, and other healthcare professionals who specialize in transgender health. They will work with the individual to create a plan tailored to their specific needs, goals, and circumstances. If you or someone you know, like your child, is struggling with feelings that sound like gender dysphoria, please know that you are not alone, and help is available. The most important step is to seek professional guidance. Talk to your doctor or find a healthcare professional who specializes in transgender health. They can provide accurate information, compassionate support, and help you explore all the available options in a safe and affirming way. Living with gender dysphoria can be incredibly difficult, but with the right support, people can thrive and live authentically as their true selves. Understanding and empathy from all of us can make that journey so much easier. Thank you so much for watching and for being open to learning about this topic. If this video was helpful, please give it a thumbs up and consider subscribing for more content. Your support helps us continue creating these important conversations. Stay safe, be kind to one another, and we'll see you in the next video.